Welcome to an easy game. Gross and microscopy explain. Fibroadenoma. The topic is of paramount importance and the importance is given in the enclosure. Since there is a fibrous as well as a glandular component, it is called a fibroadenoma. It is a benign tumor of the breast with representations of the epithelial and the stromal elements. Stromal means fibrous. It is common in females in the younger reproductive age group between 20 and 30 years, most common around 20 years of age. It presents as a slowly growing, painless mass, and it is described as a mobile breast mouse. Mobile in the sense it slips under the palpating fingers. That is why it is felt better with the flat of the hand. In this, I would like you people to appreciate the slit-like spaces. The size is usually 1 to 5 centimeters, but when it is more than 5, we use the term giant fibroadenoma. Look at this one. I am finding a tumor which is circular or ovoid, and then in this I am finding solid areas as well as slit-like openings. This is a mounted specimen of the tumor. No normal tissue is seen in this, and it measures dash into dash into dash centimeters. The external surface is smooth and shiny, but mildly bosselated. Bosselated means undulating or bulging. The cut surface is pinkish white and solid. But in this I am finding multiple slit-like areas which produces a cut cabbage appearance. What it is, we shall be seeing. This is a superb specimen of a mounted fibroadenoma. I am seeing solid areas as well as slit-like areas, slightly whorled appearance, but the fibers are all regularly arranged. No areas of hemorrhage or necrosis. Externally, there is a condensation of the pseudocapsule. Here I am finding multiple slit-like areas, and this is described as a cut cabbage appearance. Remember these two letters P and I. P has a lumen, I doesn't have any lumen as such. This is the tumor and this is the surrounding pseudocapsule. In the tumor I am finding bluish areas which indicate the nuclei. So this is the glandular element. See the well-formed gland over here, and this is the stromal element. Section study shows tumor. The tumor shows both glandular as well as stromal elements. The epithelial cells are cuboidal to low columnar, and they are arranged in and around a well-formed and intact lumen. This is called a pericanalicular pattern. Letter P, it has got a lumen. In some places, they resemble like compressed slit-like spaces, which we shall be seeing subsequently. The letter I doesn't have any lumen, and it is called intracanalicular. The glandular structures are surrounded by the slender elongated fibroblast-like cells. So in this we can see, pericanalicular, the lumen is intact, and intracanalicular, where it is compressed to slit-like spaces. And these are areas of the stroma. No mitosis, no necrosis. Microscopically, we can see this. This is the pattern. I find that there is the compression of the glands into slit-like spaces, and they are all supported and separated by the stroma. Externally, I am finding a pseudocapsule. Because of this, it is a well-circumscribed mass, and the tumor can be scooped out by the surgeon by a process called enucleation. And this is just like removing the kernel from the coconut. See you in game 26.